We're the largest facility on the coast. We're 355 beds, inpatient beds. We have a very large outpatient population. The hospital owns and runs about 105 different clinics in the outpatient community. We started doing that after Katrina. We had a big impact from Hurricane Katrina back in 2005, where we lost a number of physicians. So the hospital's changed its strategy to employ physicians instead of just having physicians contracted, so they can't just pack up and leave if we have another disaster. Our ownership structure is different than other facilities. We're a public-owned facility controlled by the city and the county. So we answer to them. Our board of directors is appointed by the city and the county. So a lot of our funding comes from the city, the county, and the state. We're not a private facility there's a corporate facility like a tenant or an HCA or something like that. As far as PACS, we do about 190,000 procedures a year right now. That's just in radiology. We're a Cerner site, so we're Cerner EMR, Cerner RIS. We put that in about 4 years ago, and we've integrated that quite well with Sectra. We put a very large priority on technology. We have a very large IS support system in our department, or in our hospital, that started with the implementation of the Cerner. Our IS department's grown tremendously. So radiology still owns our PACS, but we're actually in the process of moving hardware into the VM environment that's under IT. We've actually been using the Sectra PACS platform since 2003. We signed a contract directly with Sectra in 2008 for service and support, and we've been with them ever since. The physicians, Sectra PACS is the best PACS they've ever used, and I have physicians that have been at our facility for 25 years. We have several younger radiologists that are coming from other facilities, and this is the easiest, most comprehensive PACS that they have ever used in their life, and they love it. They do nothing but speak highly about it. We are in the process of moving to Sectra UniView, which is a zero-footprint viewer. It's a multi-modality viewer. It's not, the days of PACS being for radiology is kind of coming to an end. So a lot of us have been fighting that over the years, but with the digital pathology coming into play, wound care, dermatology, all the different things that can go into a PACS, you need a viewer that can display those. It's just not for radiology anymore, like I said. To move from the current viewer, which the Sectra current viewer is light view, to the new viewer, UniView, there's no cost involved in that. Sectra is sunsetting light view. They're moving to a stronger platform that can have multiple things built into it, and that's UniView. There's no charge for that upgrade. So UniView is a much simpler platform to use. The physicians can easily navigate it. They don't require a lot of calling the help desk or calling for assistance. It's very intuitive for the physicians to navigate, and the buttons are very clearly labeled. Anything they need to do there's zero training involved in it. All the users integrate with the Sectra PACS through Active Directory, so we don't have to add users to UniView. That all links up with PACS and Active Directory, so anybody that has access to PACS has access to UniView. UniView is very user-friendly. The search capabilities for the physicians to go in and find a patient, they can obviously click directly from the patient's chart into that exam that they're looking at. That's done through a URL integration with Sectra. From there, though, they can navigate to prior exams, other patients very easily. It's very intuitive for the physicians to go in and click the search button, and it tells them type in the last name, first name, and they'll be able to find the patient. Sectra is a PACS company. That's what they do. They're not going to be bought out by anybody. They have a large enough footprint in the world and in North America that they support their product 100%. Their help desk is fantastic. That's the biggest part of PACS is support. People think it's the viewer and how easy it is for the physicians to use, but when I know that if I have a problem, I can call support and get my problem fixed immediately. I've had a 2-hour unplanned downtime in the last 15 years. And that was due to some new equipment that we were installing. And that's phenomenal. That's so important to the radiology department and the hospital as a whole.